afternoon, who all are attending the webinar. This is an enlightening session for our future generation. And I thank Jagsonpal to give us this virtual platform to conduct this Adolescent Day webinar with Aligarh Obs Gyn Society. Step towards making a stronger nation. Federation of Obs and Gynae has decided to celebrate 7th September as Adolescent Day. And this is a complete adolescent week. So adolescence is the period where there is a transition from childhood to adulthood. And how to grow into a responsible citizen is our concern. So today we are conducting a webinar on different aspects of this transition from childhood to adulthood. And audience is children from St. Fredley's School, thanks to Father Elias, JD Public School, thanks to Dr. Mukul Vashne, and Tikaram Girls School to Indu Ma'am. We shall quickly go to the subject. And now I hand over my mic to my president, Dr. Prabha Lohchab, for presidential address. Thank you.
Very good afternoon, everyone. On behalf of Aligarh Society of Obstetric Gynae, we welcome all respected principals, Father Elias from St. Fidelis, Dr. Principal Mrs. Payal Singh from JD Public School, and Tika from Mrs. Indu Ma'am from Tikaram. And dear children, so today we are celebrating Adolescent Health Week. You know, children, health is wealth. So our speaker will tell you about complete health care, mental as well as physical. So we wish all children a very good health. Lots of thanks to all principals and children for cooperation and bringing this program a successful program. So,
hello friends, I'm Dr. S.Shantha Kumari, President of FOGSI. FOGSI is the Federation of Obstetrics and Gynecological Societies of India with 37,000 gynecologists as members. Friends, this year we come with the theme FOGSI for all, always, and Dhira, stop violence against women. FOGSI believes in taking care of our adolescents because an healthy adult is only possible if the adolescent is healthy. Friends, FOGSI is celebrating the Adolescent Health Week from 1st to 7th of September, culminating in FOGSI Adolescent Health Day on the 7th of September between 4 to 8 p.m. where we are coming with a virtual program which are going to cover so many issues which are a concern to today's adolescents, parents and teachers. So we invite you all to join us for this webinar so that all your myths and fears are busted. Friends, we know that today the pandemic has made the virtual platform online education as a means of education, and that comes with its own problems. So let's see how best we can take care of the mental health of our adolescents. Friends, we have to address so many issues. Adolescents have a lot of doubts about PCOS, menstrual problems, mental health issues and peer pressure. We are here to help our adolescents. There are nutritional issues. We find anemia is a major problem. We find malnutrition, which covers both undernutrition and obesity, are issues which the adolescent faces today. Friends, together we can try to bust these myths. This year, Dhira, which is an initiative which says no to violence against women, an initiative which was started in 2016 to say that we care for our women. Dhira means courage. Courage to say no to violence against women. Friends, this year I am coming forward with a new page, Dhira online certification course. This is being collaborated with the UNICEF and WHO. We are going to do a simple online certification course which will come to all of you that will make you all aware of this menace.
Hello friends, myself Dr. Girish Mane. I am Chairperson of Adolescent Health Committee of Federation of Obstetrics and Gynecological Societies of India. आज मैं आप सबको बहुत बहुत बधाई देना चाहता हूं कि आप इस कार्यक्रम जो आपके लिए रखा हुआ है उस कार्यक्रम को अटेंड कर रहे हैं। बच्चों, ये जो आपकी उम्र है ना, ये बहुत ही बेहतरीन पड़ाव है ज़िंदगी का। ये उम्र में आप एक इरिस्पॉन्सिबल बच्चे की तरफ से एक रिस्पॉन्सिबल एडल्टहुड की तरफ जाते हो। आपके शरीर में काफ़ी सारे फिजिकल एंड मेंटल चेंजेस आते हैं, बदलाव आते हैं, और कभी कभार इन बदलाव को ना समझ पाने की वजह से काफ़ी तकलीफ़ होती है, काफ़ी पीड़ा होती है, काफ़ी कन्फ्यूजन भी होता है। और इस समय में अपने दोस्तों के साथ शेयर करके, उनकी सलाह लेके, या मीडिया की तरफ जाके, या गूगल पे सर्च करके अपनी कोई राय ना बनाएं। आपके माता पिता, आपके पेरेंट्स एंड आपके टीचर्स, दे आर द बेस्ट फ्रेंड्स एंड दे आर द बेस्ट काउंसलर एंड द बेस्ट एडवाइजर्स ऑफ योर लाइफ। और कुछ बातें ऐसी होती है कि जहाँ पे आप आपके टीचर या आपके पेरेंट्स के साथ गुफ्तगू नहीं कर सकते या उनसे बात नहीं कर सकते, तो उसके लिए आपके डॉक्टर दोस्त ही आपके काम में आएंगे। तो कुछ भी मन में दुविधा हो, कुछ विचार हो, तो अवश्य अपने डॉक्टर्स के साथ शेयर करें, उनसे सलाह मशवरा करें और फिर उसके बारे में अपने जो मत है वो बनाएं। ऑल्सो आई रिक्वेस्ट एवरीवन टू अटेंड दिस प्रोग्राम वेरी सीरियसली, क्योंकि आपके ही शहर के कुछ नामचीन डॉक्टर्स आज आपके साथ कुछ गुफ्तगू करने वाले हैं, आपको बहुत अच्छी अच्छी बातें बताने वाले हैं। मैं आशा करता हूं कि आप और आपके परिवार के सारे सदस्य इन कार्यक्रम को अवश्य देखेंगे। दोस्तों, 7 सितंबर 2021 को शाम को 4 बजे फॉक्सी की तरफ से एक बहुत ही अच्छे कार्यक्रम का प्रयोजन किया गया है। शाम को 4 बजे इस कार्यक्रम में हम किशोरवयीन जो बच्चे और बच्चियां हैं उनके लिए, उनके माता पिता, उनके टीचर्स और जो स्त्री रोग विशेषज्ञ है इनके लिए कुछ टॉक्स रखे हैं, और उसके साथ में कुछ क्विज भी रखी है जिसके लिए आकर्षक उपहार भी हम आपको देने वाले हैं। इस कार्यक्रम की जो लिंक है वो लिंक आपको, ये जो कार्यक्रम आज आप देख रहे हो, इसको जिन्होंने ये कार्यक्रम का आयोजन किया है वो डॉक्टर लोग आपके साथ शेयर करेंगे। और अगर आपके साथ वो लिंक शेयर नहीं हुई होंगी तो कृपया करके उनसे लेने का अनुग्रह करें और 7 सितंबर के कार्यक्रम को ज़रूर अटेंड करें। पुनश्च एक बार मैं आप सबका हार्दिक अभिनंदन करता हूं और मेरी तरफ से आपको अच्छे जीवन के लिए आशीर्वाद भी देता हूं। थैंक यू वेरी मच फॉर अटेंडिंग दिस प्रोग्राम। थैंक्स अ लॉट।
Over to Dr. Alka or Dr. Meenakshi.
Behavioral problems during the adolescence. Adolescence क्या होता है? It is the time when the children grow into the independent adults, and it begins usually at the age of 10 years and lasts till the late teens or early 20s. The adolescents go through various physical, mental and behavioral changes because they are trying to find out who they will become as an adult. As they grow up, they behave more like adults and less like children. Now, what are the behavioral problems we see with these adolescents? Common behavioral problems which we see during these adolescent period is they start having alcohol and start using drugs. They sometimes fall into risky sexual practices such as not using birth control or protection against STDs. They are not doing proper homework and lagging behind in their studies. They are fighting and bullying with each other. They are hurting themselves. They are stealing something or the other. They are skipping the schools. They can run away from the home to become a famous actor and anything else. And they can become the member of the gang. So these are the various activities which should be stopped, and we should stop our adolescents to involve in these type of practices. Some adolescents drive too fast, and if these risky activities are done at repeated interval or on the daily interval, then they become the behavior of the adolescent. Occasionally they do very bad judgment which requires the professional help. And why do adolescents do these such type of things? We have to see into the cause of these changes which we see in the adolescence, because adolescence is the time for developing independence. They may want to show that they are becoming independent by questioning rules or by breaking the rules. and their brain is not very much mature as of their parents, so they make mistakes, and sometimes these mistakes, they cannot change their behavior to stop these mistakes. Basically they are not doing these mistakes by intentionally, and because to or to annoy their parents, they do these things because they want to show that they are there and they have a separate entity. They don't want to hurt the parents. Basically they don't want to hurt the parents, but they think the thinking of might be different from the thinking of the children, and the adolescent want to show that they are different from their parents, so they do these type of things, and they are learning to be more independent, but they have to depend on their parents for certain uh, decisions. But the adolescence and the development of adolescence depends more on the nature of their parents also. If there is quarrel or the family atmosphere is not good, then the adolescents fell into these risky activities. But if adolescent get more love and support from the families, they fall less in these risky activities. And if you have any problem, if adolescents have any problem, as said by our senior also, you should consult your parents, your teachers, or if you cannot consult your parents or teacher, then you must go to the doctor, who can tell you that what is abnormal, what is normal for you, and how you can be treated. Adolescent with behavior problem, they need different, they certainly they need the treatment, and they need professional help such as substance abuse treatment or counseling. And we have seen that adolescent love to spend more time with their friends rather than their family. So if they are spending more times with their friends rather than family, then also they take the decisions which are sometimes not good for them also. So how can we prevent these behavioral disorders in the adolescents? This is the basically the things to be done by their parents. An adolescent should also limit the violence, like they see in the TV, movies, or in the home. This should be reduced, and the parents should tell the adolescent that how should they behave properly, and how we what we want to become like. We the parents and adolescent both, they should try to stop arguments between themselves, and they should be positive to each other whenever there is a conflict. Adolescents should listen to their parents, and the parents should listen to the adolescent also. And the parents, instead of looking on the self expression of the child, like choice of clothes, choice of hairstyle, choice of makeup, the parents should give more attention to the adolescent action. And whenever they feel that the adolescent action is not good, or they are bit different, they should try to stop it. And the attitude of both the adolescent and parents, it should be like that good behavior should be encouraged and the bad behavior should be depressed. And if they are doing anything good, then they should be rewarded. And the adolescent choice should be respected by the parents. Now, there are some new behavioral disorders which we see in the adolescent. They are the eating disorders. We have seen young girls, 13 years, 14 years, 12 years, 19 years, they are not taking anything because they want to remain slim and fit. And on the other hand, there are male like boys who want to build the muscles. They want to become muscular like Salman Khan, Amir Khan, and then so they are taking only chicken and doing excess of exercises. Both of these things are bad. And some adolescents are taking medicines to stop or to reduce their weight. All of these things are bad because they damage your heart. So the right nutrition is the best. More important, adequate diet plan should be taken. The balanced diet should be taken at proper time. And we should do, the adolescent too should do the proper exercises, no junk food. Or you can make a cheat day in the week. On that day, you can take anything, but on the rest of the 6 days,
Ma'am, please unmute. Ma'am, please unmute. Ma'am, you have to unmute yourself. Can't hear you. Amit, ma'am, unmute नहीं कर पा रहे. Amit, you have to tell her to. Amit, are you not able to unmute, ma'am?
हो गया.
हो गया.
And so, like I was saying that you can make a cheat day in a month, in a week. On that day, you can take anything, but on the rest of the 6 days, you have to take the food, regular interval, balanced diet with proper exercise and enough sleep. And you should take care of your personal hygiene very much, because if you are clean, then diseases are less. And the second important thing is teenage pregnancy. We are since we are doing obstetric and gynecological practice, we are seeing teenagers in the having pregnancy. Why it occurs? Because you have no idea of birth control and you have no idea of protection. Sorry. You fell in love with someone and you get pregnant. So this should be avoided. And if anything wrong happens to you, by any chance, then you must immediately tell your parents or your teacher or your doctor about the problem which you have faced. Because if you are getting pregnant, then it can damage your mental, physical and emotional, everything will be damaged. And third is drug intake. Drug intake is worst for adolescent, drug and smoking and drinking alcohol, because once you intake these drugs, they go directly to your brain and they are transported to the brain, where they alter your sense of alertness, pain, anxiety and consciousness. So you become drowsy and you think that your this pain is gone, but actually you are getting weak. Drugs make your brain small, and the adolescent who take drugs or smoke regularly or take alcohol regularly, they have small brains, their growth is less and their height is also less. And some teenage or adolescent think that if we take only fruits in the breakfast, then they get healthy. No, this is not right. You should take proper breakfast. And that's why we are seeing, in these days, we are seeing our young girls more anemic, more PCOD, obesity, because of improper diet. So they all can be minimized if we take balanced diet and do proper exercises. So the final tip is that you have to maintain proper relationship with your family and friends for your proper development. A strong relationship with both family and friends are vital for your healthy social and emotional development. Friends also influence you and parents also influence you. But parents influence you on a long way, because they help in deciding your career, values and morals. But the friends, they helps you in deciding your appearance, your interest, and sometimes they also help you financially if you are weak, and if you have a friend which can help you financially. But the final decision of your parents is must, and you should regard the decision of your parents. You should remain connected with your family and friends throughout. And one more important thing is, you जितने भी आपके friends हैं, जो आपके best friends हैं, you should tell your parents about your best friends. and you should invite them to the house also, so that your parents can become the friends also. And if anything goes wrong with you, so your parents can contact your friends. And the important thing is, if you want to discuss with your parents, so you should keep your mind open. It should be without any bias, and you should be ready to listen to your parents or express yourself to your parents. There should be vice versa. ऐसा नहीं कि हमें ये काम करना है तो करना है, ये जिद नहीं होना चाहिए. आपको अपने पेरेंट्स का भी ध्यान रखना चाहिए. और अगर कोई बात ऐसी है जो पेरेंट्स आपको मना कर रहे हैं, तो आप उसको सोचना चाहिए, समझना चाहिए कि why they are saying no, instead of नहीं हमें तो करना ही है. ऐसा नहीं होना चाहिए. You should talk to your parents in a very cordial way. You should avoid drugs and alcohol. You should avoid sexual activities. You should take regular diet at proper time, good sleep, proper exercises, love your family values and cultures, respect your parents, teachers, seniors, grandparents, and lastly, your country, because your country needs you. You take good education, higher education, and then you go abroad for settlement. That is wrong. आपको जितना पढ़ना है पढ़िए, जितना एजुकेशन लेना है ले लिए, बाहर से जाइए, एजुकेशन लेके आइए, लेकिन उसका फायदा तो अपने देश को दीजिए, क्योंकि आपका देश ने आपको पैसा खर्च करके इस लायक बनाया कि आप किसी लायक हो सकें. सो व्हाई टू गो अब्रॉड? अगर आपको अब्रॉड जाना है तो पढ़ने के लिए जाइए, लेकिन सेटल अपने देश में होइए, क्योंकि योर कंट्री लव्स यू एंड योर कंट्री नीड्स यू. सो जय हिंद, जय भारत. किसी को कोई प्रॉब्लम हो तो फिर बताएं, पूछें. अगर मैंने कुछ गलत बोला हो तो देन थैंक यू.
थैंक यू अलका. इस सारे टॉक के बाद बस मैं एक ही चीज अपने बच्चों को और बताना चाहती हूँ कि एडिक्शन का मतलब खाली अल्कोहल और स्मोकिंग से नहीं है. अगर आप स्कूल जाते हैं, कॉलेज जाते हैं, अगर आपका मन कोई भी चीज बार बार करने का करे, कोई भी चीज बार बार खाने का करे, तो जरूर इस बात पर ध्यान दीजिए कि कहीं उसमें कोई एडिक्टिंग एलिमेंट तो नहीं है जो आपकी हेल्थ को बाद में नुकसान पहुंचाएगा. तो प्लीज हमेशा याद रखिए, एडिक्शन केवल अल्कोहल या स्मोकिंग का ही नहीं, बल्कि हर चीज का हो सकता है. चाय का एडिक्शन, कुछ खाने का एडिक्शन, कुछ लोग मोमोज खाते हैं, कुछ लोग मैगीज खाते हैं, तो वो अभी अनीमिया एंड न्यूट्रिशन में आपको पता चलेगा. Dr. Namrata is our next speaker for anemia and nutrition. So please go ahead. I'm inviting Dr. Namrata Bhardwaj.
Thank you, ma'am. Thank you, ma'am. Am I audible to everybody?
Yes.
Thank you. A very good evening to all. Thank you, Dr. Meenakshi. Thank you, Prabha ma'am, for giving me this opportunity. मैं अब directly अपने बच्चों को ही address करूँगी. I'll try and make my presentation as interesting as possible and as directed towards you as possible, because हम लोग as doctors कभी-कभी बहुत ज़्यादा technical हो जाते हैं. डॉक्टर अलका ने बहुत ही beautifully आपको बहुत सारी चीजें बताई हैं. I will just like to highlight the points as far as anemia and nutrition in adolescence is concerned. Can I have the next slide, please? Health. What is health? See, health is a unity and harmony within the mind, body and spirit, which is unique to each person. क्या मतलब हुआ इसका? Health का मतलब ये नहीं कि आपकी body सिर्फ स्वस्थ है. It is also essential that your mind is equally healthy and your moods are also good. That means you are healthy in spirit also. Next slide, please. So why are we here? We are here to ensure that all of you, each one of you has a smile as beautiful and as sweet as these children. Next slide, please. So let's take a look at what are the challenges of adolescence as far as nutrition and is concerned. The first challenge is that of anemia. I'll let you know what I'm talking about. Malnutrition and anorexia nervosa. I will not talk about anorexia nervosa, and I don't want any of you to know what I mean by anorexia nervosa. I will only limit myself to anemia and malnutrition. Now remember, malnutrition does not mean undernutrition only. It also means obesity. So, thank you, Dr. Ruchika. Can I have the next slide? Anemia. Anemia का मतलब खून की कमी. All of you are students of science. You all know that we have red blood cells in our body, and they carry the oxygen in our body. Whenever there is a decrease in the pigment of heme in our body, this causes anemia. ठीक है, इसको कहते हैं in layman terms में खून की कमी. Okay. Now we have to understand the magnitude of the problem, because anemia is one of the leading causes of morbidity. Morbidity का मतलब बीमारियां in our country. Now, almost 56% Indians are adolescents are anemic, and 1 in 6 persons in the world are anemic. Out of this, 1/4 are Indians. At one time, almost 64 million girls are anemic in our country. Can I have the next slide, please? Uh, why do we need to know? Why is anemia important to us? Why should we address the issue of anemia in your age? Because if you're anemic, if अगर आपको खून की कमी है, you will have a decreased second growth spurt. मतलब you will not gain in height, you will have lustreless hair, lustreless skin. There's a decrease in school performance. If you're tired, if you don't have enough oxygen, hemoglobin, you will be tired all the time. You cannot concentrate, so there'll be decrease in the school performance. There is decreased capacity to do work, and for girls, there is an inadequate preparation for future motherhood. Next slide, please. Can I have the next slide? So what are the causes? We don't need to go much in the causes, but of course, कोई भी चीज अगर आपके अंदर कम है, that means आप उसको नहीं खा रहे. So that is what you need to know about the causes. The other causes like decreased absorption, increased demand, and parasitic infections are not in your domain. All you need to concentrate is on deficient intake, which I'm going to talk about. Next slide, please. First, we need to know, this I'm want to tell to all the teachers also, and maybe those the mothers of the children who might have joined. हमें कैसे पता चलेगा, हम कैसे suspect करेंगे कि हमारे बच्चे को anemia हो रहा है? First thing is that the child may be tired all the time. आप उसको उठाते हैं, मम्मी उठने का मन नहीं कर रहा, मम्मी सोने का मन कर रहा है, चलते चलते सांस फूल सकती है उसकी. The child may be suffering from diseases very often. जल्दी जल्दी उसे बुखार आ जाता है, जल्दी जल्दी वायरल फीवर पकड़ लेता है, मिट्टी खाता है. See, we get a lot of children in our OPDs, जो mothers कहती हैं, मैम ये मिट्टी खाता है. That is one sign of anemia. That means उसको craving होती है अंदर से iron और calcium की, अब वो मिट्टी खाता है. आप देख कैसे सकते हैं इसको? The surest sign of seeing anemia is बच्चे की आंख के नीचे उंगली रखिए, थोड़ा सा पलक को नीचे कीजिए और देखिए. अगर ब्राइट पिंक है, that means बच्चा ठीक है. अगर आपको लगता है सफेदी है, this is called pallor. That means you should get the child to a doctor and get him or her investigated for. हर समय तो डॉक्टर के पास नहीं बैठ सकते हैं, डॉक्टर के पास जाना जरूरी भी नहीं है. So easy. Ensure that you eat food rich in iron. And it is very simple. जरूरी नहीं है कि आपको मैं बहुत सारे खराब foods बताऊं. See, आपको पता है, you all know this, or your teachers tell you this, your parents tell you this, now a doctor is telling you this. You need to take foods which are rich in iron. Green leafy vegetables, पालक, मेथी. Okay? एक संग ऐसे नहीं खाया जा रहा है. मम्मी से कहो अच्छी अच्छी डिशेस बना के देंगे, ये मम्मा का काम है, लेकिन आपको खाना है आपका काम. ठीक है? पीस, मटर, बीन्स. अगर नॉन वेजिटेरियन खाते हैं तो रेड मीट, raisins, apricot. There are a variety of foods which are rich in iron, and you need to take them. अगर आप ये लेते रहेंगे तो trust me, आपको कभी anemia नहीं होगा. Can I have the next slide? Just for the benefit of the teachers and the principals who are present here, I need to tell you that Government of India is running a program called VITS, in which, at least in the government setup, they are providing weekly doses of 100 milligram elemental iron and 500 micrograms of folic acid tablets to all children per week. And in addition to that, twice a year, they are giving albendazole tablets for deworming. मतलब अगर बच्चे का पेट खराब भी हो रहा है तो उसके worm infestation worms हो सकते हैं, which also lead to anemia secondarily. Next slide, please. Now, as far as nutrition is concerned, Dr. Alka has already told you a lot of things on nutrition, but I would like to highlight the problem of obesity which our children are facing, especially after lockdown. So, obesity now is actually a weighing issue for all adolescents. Can I have the next slide, please? Now, there are two main causes of obesity, genetic and environmental. You don't need to know anything about genetic. We'll only talk about the environmental causes. Next slide, please. Okay. फिर वही बात आपके टीचर्स ने कहा, आपके पेरेंट्स ने कहा, अब एक डॉक्टर कह रही हैं, प्लीज सुनिए और समझिए. What are the causes? Excessive viewing of television, excessive viewing of mobile, sitting all day, lack of physical activity, excessive snacking. See, I'll talk about these snacks in a few moments from now, and fast food diets. Next slide, please. Why is it important? Why should we know? Why should we remain fit? It is important because अभी आप छोटे हैं, आप थोड़े मोटे हो, आप थोड़े पतले हो, शायद आपकी लाइफ में ज़्यादा फर्क ना पड़े. But these body changes, this obesity is going to create havoc in your life after when you become an adult. जो obesity, childhood obesity or adolescent obesity is a precursor of diabetes, hypertension, heart attacks, joint immobilities, and various other problems in your adulthood. So, kids, please listen to what we tell you. We are going to tell you in the next few moments. Next slide, please. Okay, we all know Dr. Alka has already told us we need to stay active. Be active, have fun, and stay fit. Active activity, किसी भी form के. If you want a sport, you can play a sport that you like. If you know yoga, do yoga. If you know aerobics, do aerobics. If you want to cycle, do a lot of cycling. Even if you want to dance, that dance is a very, very good form of exercise. I think you can do that also. The mool mantra is keep exercise. Okay, next slide. Okay, lifestyle modifications. We just talked about having good breakfast. Please listen to me carefully, children. Breakfast is the most important meal of the day. The importance of having a good breakfast, I will just tell you. Why? If you don't have breakfast, you're going to be irritable, you're going to have a lot of anxiety, and there you will not be able to concentrate. There will be a lot of decrease in the school performance. On the other hand, when you have breakfast, the mid-morning fatigue decreases. You're active in mind, you're active in body. Obviously, your grades improve, right? Another thing, especially for the girls, that I want to tell you, if you miss breakfast, studies are telling you, this is not my saying, this is not your parents saying. Scientific studies have proved that if you miss breakfast, you are more liable to have a weight gain. Because as you miss breakfast, you're going to compensate that by eating more during the evening. And when you eat more during the evening, you are going to spend those calories and you're going to add your calories to your body. So if you eat a healthy breakfast, a balanced breakfast, you're going to spend all those calories during the day. Second, next slide. So we very familiar pictures for both parents and teachers and students. See what I meant by excessive snacking. Look at the fourth picture. टीवी देखना है देखिए, संग में चिप्स का पैकेट लेकर मत बैठिए. ठीक है? Next slide, please. Okay, this is something which I want to say. This is not actually medical, but shopping choices. This is more for the mothers who are listening in this group. If you're taking your child shopping for food items, make sure the child is not hungry at the time. Because अगर आप hungry child को लेके जाएंगे shopping करने के लिए, तो the child is going to stock on all kinds of candies and all kinds of chocolates and all kinds of high calorie foods. So always eat your meal and then go for shopping. Add variety. This is for mothers. See, children are at this age are very choosy and very picky. And so you need to add variety and add variety of nutritious food to your shopping cart. So you need to be as involved in your child's nutrition as the child. Next slide. Okay, Dr. Meenakshi just told us this. Any processed food, if it is addictive, it is bad. Please rethink your choices of food. And the commonest food that I can think of is a cold drink. See, the children go on drinking soft drinks the whole day. Yes, momos, Maggies. If you want to keep on taking, that means there is some addictive somewhere. Please rethink your food choices. Next slide, please. Okay, eating on the go. So what do we do? How do we eat? Go for a balanced diet. Watch your portion sizes. जितना खाना है उतना ही लीजिए. In fact, they say now, the nutritionists say, जितना खाना है उससे थोड़ा कम लीजिए. And always remember, French fries are not veggies. See, when your mother tells you eat your vegetables, अभी तो हमने French fries खाई हैं. Please remember, French fries, potatoes are not categorized under vegetables as far as nutrition is concerned. no sodas, artificial juices, or energy drinks. Dr. Alka has told you no energy drinks, at least, especially no bodybuilding. Next slide. Okay, so we need to go out to restaurants at some point of time. What tips should you use in your restaurants? Don't hog whatever's there. Add salads and soups in your order, because salads and soups are dishes which do not have that much of calorie. Try and order grilled or baked vegetables or non-veg chicken or fish rather than fried. And order fresh fruit and not high calorie desserts. See, let me tell you, as Dr. Alka also told you, you can have cheat days. It is ऐसा नहीं है कि आपको बिल्कुल साधु संत बनना है. Have cheat days. But if you're going to restaurants regularly, which I hope we all will start doing after some time, please make sure that you do not always order very high calorie diet. Next slide, please. Okay, all kids know this. Tips for fast food joints and malls. I'll try and highlight a few points that you children do. Order single slice pizza. Have grilled over fried vegetables. Try and have whole grain bread rather than simple white bread. Order side dish of salad, because salad is very filling. It does not have much calorie. Frozen yogurts and small portion sizes. Always remember, small portion sizes. Next, please. See, I'm going to quickly tell you a few items with their alternatives, and you will be amazed to know how much calorie difference there is. For example, if you take a paratha, you're consuming almost 200 kilocalories, as opposed to a plain roti in which you're consuming only 80 kilocalories. A pulao or fried rice will have 170 kilocalories, whereas a plain rice, boiled rice, will have 80 kilocalories. Similarly, you can always substitute curried chicken or fish with grilled chicken or fish, fried eggs or omelette by boiled or poached eggs, and regular desserts with fresh fruits, etc. So these are small tips which will go a long way in avoiding or preventing obesity in your cases. Can I have the next slide, please? Okay. In the end, I would just like to say the whole purpose of this webinar, the whole purpose of our talks is that our adolescents are resources which have to be developed, and they are not problems to be fixed. So as Dr. Alka also told, please have communications lines open amongst each other, with your parents, with your teachers, and if required, with your doctors. Thank you very much for a patient hearing.
It was a nice talk. Next speaker is Dr. Anjali, and she will talk about a very usual viral infection, HPV, and how to protect HPV. Dr. Anjali.
Good evening, everybody. Thank you, Prabha Lohchab ma'am, Alka Mittal ma'am, and Namrata ma'am for providing, and Meenakshi ma'am for providing me this opportunity to just spread some knowledge on this HPV infection and vaccination. I'll try to remain more simple and precise to make this adolescent group peoples understand what HPV infection is and how we can prevent this by simple vaccination. Can you just put on the next slide, please? HPV infection. HPV virus is a DNA virus from papillomaviridae family. 90% of the HPV infection, it resolves spontaneously within a year or two. In some cases, HPV infection may persist and result in either warts or precancerous lesions. Nearly every individual is infected by HPV at some point in their life. HPV is the most common sexually transmitted infection in present day era. Next slide, please. How this infection is transmitted. This transmission of these virus, it occurs through close contact. The virus particles are released from the surface of these papillomatous lesions and further causes infection at the cutaneous and the mucosal sites. Next slide, please. More than 100 types of HPV infections are there in the HPV viruses are there in the environment, out of which 40 types are there which infects the mucosal as well as the genital regions. And about 60 types are there which infects the non-mucosal as well as the cutaneous surfaces. Out of the 40 types which infect the mucosal as well as the genital region, they are further categorized into high-risk types and low-risk types. 16, 18, 31, and 45 are the high-risk types, which are responsible for causing low-grade cervical abnormalities, They act as cancer precursors. They are responsible for causing anogenital cancers. Whereas the low risk types 6 and 11 and others, they are responsible for causing low-grade cervical abnormalities, genital warts, and laryngeal papillomas. Out of the 60 types which are affecting the non-mucosal as well as the cutaneous areas, they are responsible for causing skin warts in hands and feet. Next slide, please. Now, how this HPV infection is transmitted? It is transmitted via skin-to-skin contact with an infected individual. It usually gets transmitted by having sexual contact either through vaginal, oral, or anal route. Vertical transmission. Vertical transmission is the transmission which occurs from mother to the newborn fetus. Non-sexual routes are also there which spreads this infection. How can we identify that we are suffering from human papilloma virus infections? This can present in the form of skin warts, plantar warts, flat warts. In genital areas, they occur in the form of condylomas, and in larynx, they arise in the form of laryngeal papillomas. Now I'm showing you some of the pictures which may help you to identify what exactly they look like. This is a picture of superficial flat warts present over the thumb region. Next slide, please. These are the plantar warts which are present over the region of sole. These are the internal warts which are present over the buccal mucosa. In men, they appear on the foreskin of head or shaft of the penis and in the anal area, urethra, and scrotal region. In women, the genital wart usually starts to appear on vulva, in the vagina, on the cervix, and in the anal area. This is a picture which showing the HPV infection over the anal perianal region. You all might have heard of tree man. Tree man is nothing but this patient is suffering from human papilloma virus, which has led to the formation of rare skin warts. So how can we prevent these human papilloma virus infection? HPV vaccines can prevent most common types of infection caused by HPV virus. To be more effective, vaccination should be given before the onset of sexual activity. So its recommended age is 9 to 13 years. But however, it can be given to all females between 9 to 45 years of age. Now, the vaccines which are available in Indian market, two types of vaccines are there. One is the quadrivalent vaccine, that is HPV4, commercially available in the name of Gardasil. It contains type 16 and 18 high-risk viruses and type 6 and 11 low-risk viruses. The other one is the bivalent vaccine that is commercially available in the name of Cervarix. It contains type 16 and 18 high-risk viruses. Both vaccines are supplied as a liquid in a single dose vial or a syringe. Neither of the vaccines, they contain any antibiotic or a preservative. Next slide, please. Now the dosage schedule. How should we get ourselves vaccinated and at what interval we should get vaccinated? The quadrivalent vaccine, that is Gardasil, it's to be given in 0 to 6 month schedule. That is, if you have got a first dose, that is considered to be the 0 dose. Then you have to get yourself vaccinated after 2 months of the first dose, and then again 6 months counting from the very first dose. The bivalent vaccine, that is Cervarix, the dosage schedule for it is 0, 1, and 6 months. That is, 0 dose is the first dose. Again, you have to get yourself vaccinated 1 month later, and the third dose 6 months later of the first vaccine. Next slide, please. So at the end, I would like to say you don't need to cure cancer if you can prevent it. So I would request all the adolescent girls, please, please go yourself vaccinated so as to prevent and curb the load of this disease. Thank you.
Thank you, Dr. Anjali. Dr. Meenakshi has had to leave for an emergency, so I'm taking over from her.
Okay.
That concludes our sessions for today. Are there any questions from the teachers or from our children? We would be happy to take them. You can put your questions in the chat box if you want.
Good evening, everyone. And it gives me an immense pleasure to deliver the vote of thanks for this event to all assembled here. like my colleagues, principals and teachers of participant schools and our special guest, yani ki bacche, going to become adult. I would like to thank our speakers who honored this session with their inspirational thoughts at almost each aspect of health. I would like to thank our FOGSI President, Dr. S.Shantha Kumari, Dr. Girish, Chairperson Adolescent Health Committee, FOGSI, for taking adolescent mental and physical health to FOGSI platform, and our team to taking it to the schools, and they managed it very well, and almost every aspect is covered. And but in the last but not the least, thank to our beloved audience for being part of it. Like, take home message is that adolescence is a critical link between childhood and adulthood, characterized by significant physical, psychological, and social transition. These transitions carry new risks, but also provide opportunity to positively influence their immediate and future health. Thank you all.
Thank you, Dr. Deepika. Thank you, Jagsonpal people, all of you, for a very, very, for your inputs and for your help. Thank you, everyone. Thank you so much.
Thank you very much. I hope this session has been entertaining and informative for the young children who had joined, the young adults actually who had joined us.
Yeah,
today.
just a moment. Sorry to interrupt you. I think there's a question from Yash Sengar. It is necessary to have vaccination. Yes, for all girls, it is necessary to have vaccination. Better, all girls. All girls.
And this is for our doctor fraternity, those few of those who have joined. Day after tomorrow, we have another webinar which will be on recurrent pregnancy loss, powered by our dydrogesterone tablets of Divatron. So do join us